The CDC and various media agencies went on a scaremongering campaign about e-cigarettes towards the end of last year, undermining their credibility on the eve of a true public health crisis. So how do we know who to trust? Find out more on this edition of Ruthless Insider. The CDC's switch from vaping to COVID-19 highlights the moral and practical differences between actual epidemics and the metaphorical epidemics of risky behavior, both of which fall under the all-encompassing umbrella of public health. Even within that framework, which is built around minimizing morbidity, the CDC's conflation of EVALI with vaping in general was counterproductive, impeding the harm-reducing shift from conventional cigarettes to nicotine delivery systems that are far less dangerous. By fostering confusion about the relative hazards of smoking and vaping, the CDC damaged its credibility on the eve of a public health crisis in which policymakers and the rest of us are expected to rely on its expertise. While there is plenty of room to debate about the legality, propriety, and effectiveness of specific policies aimed at curtailing the spread of COVID-19, there is a stronger argument for coercive measures when we are confronted by a potentially deadly disease that moves from person to person. That argument is much less compelling when we're talking about self-regarding actions that may lead to disease or injury but do not inherently endanger other people. The CDC was predisposed to view vaping as problematic, a prejudice that colored its depiction of EVALI. Even though it was clear early on that vaping-related lung injuries overwhelmingly involved black market cannabis products, the CDC repeatedly insisted that legal nicotine-delivering e-cigarettes might kill you. That message endangered public health by implying that people, teenagers as well as adults, would be better off smoking, which is demonstrably not true. We have to hope that the CDC's COVID-19 recommendations are more scientifically grounded than its initial scaremongering about e-cigarettes. I assume they are, but when public health agencies stray beyond their central mission and allow moral panics to affect their advice, they undermine the public trust that is vital at a time like this. How has the CDC's treatment of the EVALI scare impacted your feelings about their ability to manage a legitimate crisis? Please share your thoughts with us down below, and as always, don't forget to like, share, subscribe, and ring that bell button to keep up to date with all of our Ruthless content. This has been Nick with Ruthless Insider, and we'll see you next time.